Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for Your Health. For Your Health is a program that looks at various health issues, health concerns, and helps you to stay informed. Joining me, as in programs past, is the Public Health Coordinator here in the city of Quincy. That would be Caitlin Pico. Caitlin, welcome back.
Thank you for having me as always.
Pleasure to have you, and you are in our Studio A, which is a brand new, well, not brand new studio, but the lights are a lot newer. We have a brand new set. No, the set remained the same, but the lighting has been enhanced.
It's a lot brighter. Could maybe use some sunglasses, but it's great. It's
okay.
good.
Good to note. I don't have those, but I do have my reading glasses right here. So if I do need any assistance, you'll see me put those on. I should mention, Caitlin, that these programs, though recorded here in the city of Quincy, have gone throughout the country because all these topics certainly don't know a geographical area.
Yes, and all the information I do obtain is from this, mostly from the CDC. So it is universal information, but of course if people want more information on it, they can always go directly to the CDC website and look up whichever topic we're discussing for some more information.
Very good. Today's topic, which I think was a suggestion of mine, because you simply see the ad for the vaccine for it constantly on TV, and that is shingles.
Yes, and I get a lot of calls working in the health department, a lot of calls asking about shingles. Should they get the vaccine? When should they get the vaccine? So it's definitely a topic that people need to know about, especially with all that advertisement out there for the vaccine. So definitely we'll walk through the symptoms and all of that today just to discuss what is right for the audience.
We were talking before the cameras were rolling, and the word shingles, we were trying to figure out where that came from, but it's actually the pattern of the rash, and we'll get into that, which kind of relates back to a Latin word. A lot of these medical terms do have roots in that language.
Yes, and from the research, you found that it was because it's in like a belt. That's what the Latin word. So it's because of the way that this rash comes out. We'll go into that, and I'll show a picture or two as well, just to kind of show the viewers what they may expect if they were to get shingles.
Very good. Well, I'm going to try this without my glasses right now. We'll go through the outline first so people know what to expect. You did talk about the photos that folks will see in just a moment. But the outline: what is shingles? Signs and symptoms, transmission, complications of shingles, treatment and prevention. How's that without my glasses?
Perfect.
Perfect. Okay. So, what are shingles?
So shingles is a viral infection, and this is caused by the varicella zoster virus, which is very commonly known because this virus also causes chickenpox. So a lot of times when you hear shingles, it goes hand in hand with chickenpox because it's the same virus. So basically what happens is when a person is exposed to the varicella virus, they will develop chickenpox. Once they recover from that virus then lives in their body. It's called dormant, which also just means inactive. So basically, once you recover for years and years to come, you will have that virus within you, but it doesn't make you sick. And then as individuals get older, it can exacerbate and become shingles. And basically that's when that virus gets reactivated and it travels down the nerves to your skin and can cause blisters. And I did want to mention that although not everybody that had chickenpox gets shingles, you may still want to get vaccinated because shingles can be very painful.
Because they're on the nerve.
Because it's on the nerve endings,
right.
Yes.
Okay.
And it's important to know that even if you had shingles, you may still want to get vaccinated because you can get it again.
Which And that's unlike chickenpox, right? Generally, if you get chickenpox, you don't get chickenpox again?
Yeah, so chickenpox, you would just get it the one time, but with this, it can exacerbate into the shingles virus several different times. So definitely with this vaccine out there, it's good to get vaccinated to prevent this.
Here's I just had a thought as you had mentioned that, okay, if you had chickenpox, the virus that causes chickenpox is what lays dormant and years later can cause shingles. And I'm just thinking of age, and as a person ages, their body ages and maybe simply doesn't operate as it used to when they were younger.
I was trying to find the exact cause, and it can be different for like every person. A lot of it is with age, your immune system's not as strong. So especially like immunosuppressed individuals, this is something they want to consult with their doctor about, because you want to make sure that your body is strong enough to fight off the infection.
Absolutely.
Yeah.
Okay, we will look at signs and symptoms, and this is probably where we do get to see the images.
Yes, yes. So I do have two images. Quickly, I'll just go over what the symptoms are. So first, of course, the most common is that painful rash. This develops on one side of the body or face, and it commonly consists of a strip of blisters that will typically scab over in 7 to 10 days and fully resolve within 2 to 4 weeks. But it's very important to know that although you might not get this rash, you could have pain in that area for several days prior to the rash developing. And also, even after it heals, we'll go into the complications, but there is a common complication where you can have that nerve pain for years to come following.
Years?
Years. It can be months to years, and it can be debilitating pain. So that's why you really want to protect yourself. And it's also important to know that if an individual is immunocompromised, whether that's due to a diagnosis or a treatment that they're getting, they can get, instead of just one side of the body, you could see more of like a chicken pox rash, kind of more all over you.
Oh, really? Okay.
Yes. But and another thing, if it's in your face area, that's also an emergency.
Eyes.
Because if it goes into your eyes, it can cause vision changes, even blindness. And just a couple other things people may experience are fever, headache, chills, and stomach upset. So definitely check in with your doctor right away if you think you potentially have shingles.
Now, I know with chickenpox, and we'll get into transmission in just a moment, the weeping was a way to carry, I think, the
Yes.
chickenpox, but not so with shingles. Do they weep? They're blisters, so they must.
Yes, so they do. It's very similar to the chickenpox blisters, but also with transmission of this virus, because again, chickenpox and shingles, it's the same virus. So if somebody's exposed to fluid from somebody's wounds from shingles, they can then get the varicella virus in their body.
Okay.
And if they're not going to necessarily get shingles, but if they never had chickenpox before, they can get chickenpox.
Interesting.
Which
You
is
have to have
interesting.
chickenpox first.
Yes. And then if you had chickenpox, like for example, I had it when I was young, if I were to come in contact with somebody with shingles, I'm not necessarily going to get shingles because I already have the virus dormant in my body. So it's not going to give me chickenpox.
That's an interesting
It is very
virus.
interesting.
Yeah, and that it really can deliver two different problems, two different diseases, if you will.
Yes. And before we go to transmission, I almost forgot those images. I know we spoke about them twice. But if we can pull it up on the screen, we have two images. One just shows the strip of the blisters on one side of the person's abdomen. And then the other one is right on the eye. So you would see the person with that, the rash on their eye could be at risk for losing vision if it's not treated properly. But I'm sure the image is from CDC, so I'm sure that individual went for care.
Right, and the image again, resembles a band or a strip.
Yes, it's normally like a strip across one side of your body. And again, it's only on one side of the body because it's on the nerve. It's because it has to do with the nerves. So that's why it's only on one side. You don't commonly see it like across your abdomen.
Yeah, that alone, it just makes me realize how complicated our bodies are.
Yes,
right?
very complex
And amazing,
systems.
too.
Yes.
All right, so transmission.
Yeah, so transmission. So I feel like it's a very straightforward with shingles and chickenpox, so I feel like I could be repeating a lot of information.
That's always good for me.
Yes. So as I before mentioned, the shingles is caused by a reactivation of this varicella zoster virus. So really, there's no known cause as to why it exacerbates in some individuals. It could be if like you get older and you're immunosuppressed, that's when you may see it. The likelihood of you getting shingles increases with age. The infectious period, so an individual cannot spread shingles before the rash. So as I said, you might have that pain in the area you're about to get the rash, but as long as you don't have an active, like, what word am I trying to get? Like a seeping wound, you're not going to pass it. And then once those blisters also crust over, you're no longer infectious. So with that, it's kind of common sense. If you were to get shingles, you want to make sure it's covered. You don't want to go out in public with opened weeping wounds. One that can lead to infection for yourself, and you don't want to spread it to others. So that's mostly how it will transmit, is if somebody comes in contact with fluids from the draining blisters.
I'm looking at transmission, and I'm just going to read this. If an individual has never had chickenpox or never received the chickenpox vaccine. So there is a chickenpox vaccine.
So it's the varicella vaccine.
Okay.
Yes.
And comes directly in contact with fluid from an individual, then they can very easily get shingles at that point.
Yes, and you want to think of that, it's because if somebody had chickenpox or they received the varicella vaccine when they were young, and when I was doing my research, I believe the CDC said that if you were born before 1980, it's likely you did have chickenpox, even if you don't remember it. But anything with any vaccine, you want to consult with your doctor because they would probably still advise you to get this vaccine. And we'll go a little bit more, a little further when we get to prevention. I'll go into who should get the vaccine versus who shouldn't.
And maybe we talked about this and I missed it, but the chickenpox wouldn't land on the nerve, and that's the basic difference between the chickenpox virus and maybe...
I believe so. I think the, I
Shingles?
apologize, I don't have the exact information on that. But I do know chickenpox is more widespread.
It doesn't have the pattern.
It doesn't have a pattern, and your body has no immunity to it, whereas the shingles, like your body, you already had the chickenpox, and at this point, it's just that virus going along your nerve endings. It's not affecting your entire body.
Right, and I mean, it was a while back, because I'm, 54? We just had this conversation. So I probably had chickenpox when I was in my teens. Mm-hmm. And I don't remember pain. I do remember the itchiness. Shingles gives you the pain, and do you not have itchiness, or do you?
You could have itchiness with it as well. When we get to treatment, I'll go over some of that information. The most common symptoms you think of with shingles, though, is a strip of blisters with severe pain. So I'm sure there is itching with it, and some people will complain about that, but it's kind of the pain is a little bit more overwhelming than the itchiness.
And then, of course, chickenpox was all over the body. It wasn't one side. This is one side.
This is one side,
For the most
yes.
part. Let's talk about complications. You did address the eyes, and certainly if it's not treated and around the eye, it could cause blindness.
Yes, so that is one big one. The most common complication people will experience is long-term nerve pain, and this is called postherpetic neuralgia. I apologize if I mispronounced that. But basically what this is once you have the rash and it resolves, so say you had it on your torso, once it resolves, you can have pain there because, again, it's on the nerves. So that nerve pain can last for months to years following your recovery. They do say this pain can be severe and debilitating. It can affect a person's daily life to life. Because you think of that, if you had it right under your arm and you're going to brush your teeth, but you have that nerve pain, you're going to experience, like brushing your teeth is not going to be as easy anymore.
Right, right. And then could cause other problems because maybe you won't brush your teeth. You know what I mean? It could have a domino effect, I guess.
And they say that 10 to 18% of people who get shingles will experience this complication. And again, your risk is increasing with age. So I strongly suggest getting vaccinated. I just left my own house and I asked my parents, I'm like, are you guys vaccinated? You gotta go.
I would assume anyone close to you gets that advice, health advice, quite often.
Quite often.
Which isn't a bad thing. That's a good thing.
And then some other symptoms that you might see is pneumonia, hearing problems, encephalitis, which is brain inflammation, and it's very rare. It can lead to death. I shouldn't say rare, but it's not as common. Shingles is not normally known as like a death sentence by any means, but it's important to know, like, if somebody's severely immunosuppressed and they get shingles, they could have a lot harder time recovering from it.
Now we will address treatment. So prevention is always the best.
Yes.
That's the best tool to use.
Prevention's always our favorite topic.
Right, absolutely. So don't get it in the first place. But if you do get it, now we'll talk about treatment for it.
So if you do get it, so there is an antiviral, there are a couple antiviral medications that they could use. For example, they do acyclovir is one of them. So these antiviral medications can be used to treat shingles, and what they do is they shorten the length and the severity of the illness. So with that, you want to know that it's most effective to take it as soon as possible. So if you start to notice a rash and you don't know what it is, call your doctor, because the sooner you see your doctor and get this antiviral medication started, the sooner you're going to see some relief.
And you did mention that the pain comes first. So how long, again, between when the pain hits and when you actually get the blisters?
So they say it can be several days. So that's another thing. It's gonna, a lot of times, if you're calling your doctor and you're like, I just have severe pain on my skin right here, they might be like, okay, monitor it.
Right.
But at least if you're reaching out, your doctor will kind of at least have, the facility and the staff will have at least a warning that you may have to come in if that does continue and you do end up getting shingles.
Right, and they may say, well, in a couple of days you might start to see a blister, in which case you probably have the shingles.
Yes, so it is very, a lot of healthcare, you want to catch it before it gets bad.
Right.
Because if it's already severe and you're going to get help, it's more just trying to help with the pain management and the itchiness and all of that. So definitely keep in touch with your healthcare provider. And then, so that is the main form of treatment of those antivirals. As far as pain management, the CDC recommended consulting with your doctor because for some individual, over-the-counter medications can help to take away the pain. But some individuals, depending on your severity, you may need a prescription from a doctor. So just instead of saying on the show what medications to take for pain management, I would like to leave that to a healthcare provider, just because everybody's a little different. So I want to make sure that people get the best advice on pain management. Some techniques you can do to reduce the itchiness, which can kind of help with the pain, is wet compresses, calamine lotion, and then like an oatmeal bath. Those are all things you can do to kind of soothe your skin and soothe the area.
Very good. I'm just going to make a note to my director that I forgot to turn on the clock for this program, so I have no idea how long we have been talking, and I probably should have a good idea when it gets close to the half hour, because it's easy to go on some of these topics.
It is.
Let's talk about prevention, because again, most important if you can prevent the illness from the start.
Yes, and I know I've mentioned the word vaccination probably 100 times so far, but vaccination is the only way to protect yourself against shingles, and then again, that complication with the prolonged nerve pain. So it's very important to get your vaccine. So the CDC recommendations for this vaccine, so it's the Shingrix is the vaccine that they're recommending.
Which, of course, is what we talked about, is all over the TV. It seems to have an expansive budget.
Yes, a lot of advertisements for it. And it is recommended, so for adults 50 years old and older, they should be getting 2 doses of the Shingrix, and these doses can be separated 2 to 6 months apart. For adults 19 years old and older, if they have a weakened immune system, their healthcare provider may also recommend they get the vaccine, and that would also be 2 doses if you're 18 and older. And then individuals with weakened immune systems, they can get this vaccine, but sometimes, depending on the doctor's recommendation, instead of waiting 2 to 4 months in between doses, they could get it in between doses more like 1 to 2 months, depending on the situation. And if I did see that in my research, it's way more common with adults. That doesn't mean a child cannot get it. So if
that's a good point. Okay.
Yeah, so if a child's immunosuppressed especially, if there's any concerns for shingles for your child, just reach out to the primary care doctor just to get some advice. But normally we don't typically see this in children. It's normally older adults.
You should get Shingrix, which of course is that vaccine, even if in the past you had shingles. Mm-hmm. The vaccination can help prevent future occurrences of the disease.
Yeah, so definitely if you had chickenpox, you had shingles, just because, again, you had shingles once doesn't mean you're not going to see it again. So we do say to still get that vaccine. The CDC also says you should still get the vaccine if you received Zostavax.
Now that's another drug.
So that was a previous vaccine that is no longer used in the United States. As of November 18th, 2020, that's when they stopped using that. So they say, according to the CDC, if you did receive that vaccine before 2020, consult with your healthcare provider when would be the best time for you to get this new 2-dose treatment, or 2-dose vaccine, I apologize. And then also, one thing, if you got the varicella vaccine, normally children will get that vaccine. That's the chickenpox vaccine. So even if you got the chickenpox vaccine when you were young, you still want to get the shingles vaccine currently. And that's kind of the same thing. If you got the chickenpox vaccine back in the day, it's kind of the same as having the chickenpox back in the day. You would have a little bit of immunity, so that's why you want to protect against shingles. And then I just wanted to quickly highlight who should not get that vaccine, the Shingrix. So anybody who's had a severe allergic reaction to any of the components within that vaccine, or if you've received your first dose and had a severe allergic reaction, you should not get the second. And if you currently have shingles,
which is very interesting. So you have the blisters, you have the virus again has been laying dormant, but now
Yes.
it's not dormant anymore. You've got shingles. you can't get the vaccine?
So they say not to get it while you are currently diagnosed. So while you currently have active blisters on you, you shouldn't get the vaccine. The CDC did say there's no specific time length in between your recovery and getting the vaccine. They just say typically you want to wait until your rash has crusted over and you're no longer infectious.
And we said earlier that unlike chickenpox, where you pretty much got once and then you were done, shingles can come back and often does.
Yes, it definitely can come back. Not for everybody, but you don't want to be the person to get it multiple times. So. And then one other group of people who definitely should not get the vaccine is individuals who are currently pregnant, because it's not safe for the baby. So definitely you would have to wait till after pregnancy to get the vaccine.
But for the majority of people, it's, again, in the age group that shingles does affect.
Yes.
Those folks wouldn't likely be pregnant anyway.
Very, very true. That's a good comment. But you're just kind of seeing now, especially with technology and healthcare advancing, women are still having babies longer and all of that. So just in case you have any fear of, just consult with your doctor, but make sure nobody would give you that vaccine if you were pregnant.
I'm getting about a 3-minute warning
Okay.
here. So steps to prevent the spreading. Am I reading this correctly?
Yes. So that's the spreading. That's the varicella virus. That's a little breakdown for it.
Right. Okay.
So basically, this is if you have that rash. Again, biggest thing: keep your rash covered. Avoid touching or scratching that rash. Again, anything with a rash, if you're scratching it, you're bringing whatever's on your hands. You're bringing that bacteria to your skin. So that's never good. And you want to wash your hands often, and then avoid contact with high-risk people until your rash is completely healed. And again, that would be pregnant women with no known history of chickenpox or receiving the varicella vaccine, premature or low birth infants, and individuals with weakened immune systems, because it's a lot harder for their body to fight off this virus, whereas if I were to get it, I hopefully would be okay because my immune system's all right. But you want to make sure you're just protecting those around you and keep your distance from high-risk individuals.
Absolutely. Well, thank you very much for informing me and, of course, the folks at home about shingles today, and we welcome you back on a different day with another topic.
Thank you so much for having me.
It's a pleasure. And thank you at home for watching. Please continue to support your local access television station in the community in which you reside.